Good morning, everybody. Buenos días a todos y a todas. We are very happy to have you all here in another event for the Voices from the Field. We are excited to have you today and dive into this important conversation on housing, the connection between housing and health in Latino communities. We're still getting into our webinar. I think we're going to begin to record right now. Isn't that right, Carla?
Yes, it's started.
Okay, thank you. So I want to let you know that there has been a slight change in our panelist lineup. Unfortunately, our colleague, Dr. Bianca Ortiz-White, cannot join us today due to unexpected circumstances. I will take her place, providing you with some of the highlights of the recent report on housing and Latinos that we produced here at the Gaston. Before we begin with our panelists, I would like to share with you a few things about the Gaston and the work that we do. Can you all see this?
Yes.
Okay. So for 35 years, the Gaston Institute has been a cornerstone for research and advocacy dedicated to the Latino community. It was founded through the visionary efforts of legislators, community organizers, and Latino organizations who recognize the vital role that our community plays and will continue to play in the growth and development of Massachusetts. At the Institute, we conduct research across a wide range of areas, including public health, education, economic development, and climate change. And we always have a focus on Latino communities and localities. We also collaborate with organizations to provide expertise on culturally and linguistically responsive approaches to engaging with Latino communities. Our team is as diverse as the communities we serve, representing a variety of languages, backgrounds, national origins, but we are all united by a shared commitment to advancing equity and opportunity for all Latino communities. I would like then to introduce our moderator, Professor Adán Colón-Carmona, Professor of Biology at UMass Boston, is a plant, cell, and development biologist dedicated to advancing diversity, equity, and inclusion in higher education through mentoring and initiatives addressing cancer disparities and student success. Adán, he is a strong advocate for the Gaston and is the current director of the Latinx Knowledge Hub. Adán, welcome.
Thank you. Thank you, everyone, and good morning. Buenos dias. Welcome to Voices from the Fields webinar series that the Latinx Knowledge Hub has put together on a regular basis over the last few years. And before we begin, I just do want to describe what the Latinx Knowledge Hub is. It's a collection of academics and community members who are working on issues to trying to address health disparities in the Latino communities across the Commonwealth. And so we welcome you today to our conversation related to housing and its connections to the health of our communities here in Boston, as well as in other cities across the state. And so today we have some distinguished guests. Can you put up the slide on our speaker series? Thank you. Thank you very much. So first off, after Fabián presents the report from the Gaston Institute related to housing, we have Dr. Soumya Balacharan. She is an assistant professor and is an urban planning scholar, focuses on poverty, economic mobility, housing, and community development, critically examining credit assets, mortgage markets, and state policies while directing a UPC high school program that inspired Boston youth of color in urban planning. We also have Alex Corrales. He is CEO of the Worcester Housing Authority since 2016, has dedicated nearly 3 decades of improving housing stability and health outcomes, collaborating to empower residents, achieving transformational change, including a record number of public housing residents becoming owners. Additionally, we have Joe Ponte. He is director of Connect with the neighborhood developers, overseeing direct service programmings like emergency rental assistance, workforce development, and nutritional initiatives in the Chelsea area, nonprofits focusing on housing advocacy and affordable housing. And then finally, we have Lou Finfer. He is the director of Massachusetts Action for Justice and has been a community organizer in Massachusetts since the 1970s. He's former director of Massachusetts Tenants Organization, Massachusetts Affordable Housing Alliance, Greater Boston Interfaith Organization, and Massachusetts Community Action Network. And we will have responses from these community members after we have the presentations from Fabián and Dr. Balachandran. Okay, so welcome everyone. And before we have our first speaker, I do want to mention one thing about our presentations here. We are trying to connect the issues of housing with health, and I want both our panelists and our participants of this webinar to think about those issues that impact people's living situations, how housing directly impacts health outcomes in Latino communities in Massachusetts. And for our panelists is to also provide us with some context to these different issues. And so with that, Fabián.
Thank you, Adán. And thank you again to our panelists. We're really grateful that you had accepted to be here with us. So what I'm going to do now is provide you with some highlights of a recent report by the Gaston Institute, in which we begin to explore the challenges that Latinos in Massachusetts go to home ownership and housing. This is really an invitation for you to read the whole report. What we did today is to select a few highlights that are directly connected to health. As you know, housing is not just about shelter. It also directly impacts health, financial security, community stability. And in our report, we document the many challenges that Latinos are facing currently. So let's begin with the rate of home ownership in Massachusetts. As you can see from this graph, the Latinos in Massachusetts had the lowest rate of home ownership at 31%, which is really even low by national standards. And not standard, but at least the national rate is 51% for Latino average. In fact, Massachusetts ranks second lowest in Latino home ownership nationally after New York. There has been some improvement from 24% to 31%, representing a 30% increase. But as you can tell from the graph, there is still very, very big gaps with respect to other ethnic and racial groups. Second thing I want to mention is about the lowest median household income. Again, Latinos in Massachusetts had the lowest median household income at $62K, more or less, which is, as you can see, almost over half of the median income for white households. There has been some growth in the median household income, but at the same time, this graph is a little misleading because when you compute the growth and take into account the inflation, you'll notice that the median household income has increased for Latinos, but it's barely kept with inflation. The other thing I wanted to say is that in addition to that, and this is something that can be found in some of our reports, we have displayed how these wage disparities persist across all educational and and occupational levels. And as you suppose, as you can imagine, that makes home ownership more difficult. So the other thing is the housing cost burden, the high rent to income ratios. About 61% of all renting Latino households pay more than 30% of their income to housing. That means there's less affordable, less spendable income to save. Interestingly, is very well, not interestingly, but at least from the data, we can see that it's always tracking the percentage of renting Latino households, or renting households for African Americans as well. That means also that for African Americans and Latinos, this also increases the risk of eviction and displacement for not being able to pay rent. Finally, we know that Latinos are second to Asians living in housing that are more crowded, meaning that the number of people per affordable rooms or bedrooms is way more than what is considered standard or normal. It is about 11% for Latinos. We know as well that about 51% of Latino rented households are multi-generational, which is a very high rate, 51%, compared to white or African-American households. Now, the idea of this, as you know, the issue with this is that even though multi-generational living provides financial support, it's a way for families to be able to support and afford rent, even to support mortgages. It can also contribute to increased health risks. We saw that during the COVID-19, when Latino households were having higher infection rate due to crowded conditions, especially in some localities in Massachusetts. I mean, in closing, I just wanted to say, kind of point out why housing instability has some not just direct and long-term impacts on health. For example, we know overcrowding increases risk of respiratory illnesses. Housing insecurity leads to frequent moves, and that disrupts education, children's education, and family access to consistent health care. In addition, eviction, displacement increases stress, and we know that stress is linked to poor health outcomes. And the fact that we have such a lower household income also increase families had to make decisions between paying higher rents and affording healthcare, or being able to pay the rent, or buying nutritious food, or in overall getting an overall well-being. So in closing, I just want to say Latino housing challenges are not just about economic justice. It's a public health imperative. We believe that so, and definitely, as already pointed out, it's a fundamental determinant of health, which requires urgent and comprehensive policy solutions. With that, I would like to give the root to Professor Sonia Balachandran from UMass Boston. Thank you.
Let me just share my screen. Are you able to see my screen properly? Perfect. First of all, thank you for inviting me to the Latinx Knowledge Hub webinar. It's an absolute honor. And I must thank Rosalind Negron from the Sustainable Solutions Lab for suggesting my name. My name is Soumya Balachandran, and I'm an assistant professor at the Department of Urban Planning and Community Development in the School for the Environment at UMass Boston. I thought I was going to talk about a rather unorthodox topic, which is low income and minority homeownership. But thank you, Fabián, for setting the stage so nicely. And I think what I'm going to present will make a lot of sense. As Professor Adán spoke, I focus on poverty and poverty risk, My main interest is in examining housing policy, and I do look at the supply side issues of affordable housing and how policy influences or impedes the production of housing. But I think what I find more interesting is, and what I enjoy unraveling are the issues associated on the demand side for communities and access to and sustenance of housing and pathways to access for new neighborhoods where there are spatially distributed opportunities. Because housing, as Fabián beautifully explained, directly impacts mental and physical health in multiple ways. Being in a certain neighborhood could mean certain types of environmental toxin exposures on the one side, and just ensuring that you can pay the next month's rent can be a source of severe mental trauma for a family that is facing housing precarity. Um, I must confess, however, that this is only my second year in Massachusetts. I spent a year in Texas and a year in Florida before that. And before that, I was in the University of Illinois at Urbana-Champaign for 5 years. So a lot of my work, comes from my understanding comes from my work in Chicago, where I worked in low-income and minority communities with nonprofits there. So I'm going to talk a little bit about that. But hey, I'm getting started on a Massachusetts-based agenda. I'm a PI in a project where we recently received a small seed grant to look at managed retreat strategies for older adults in subsidized housing that are at risk of sea level rise. So we have a team of other faculty, and we're going to start working on that. And this is a 2-year project, and we hope to be able to build up our findings from this to then expand our work. I also direct a high school program that exposes youth of color in Boston communities to urban and environmental planning, environmental conservation, and to explore career pathways at the intersections of urban planning, climate change, and environmental conservation. So yeah, as Fabián suggested, Latinos in Massachusetts have among the lowest homeownership rates. On the other side, Massachusetts is always considered the poster child for homeownership programs. So we do see this dissonance. One thing that quickly comes up when we talk about housing affordability issues and housing issues in Massachusetts is almost always the conversation moves towards zoning laws and NIMBYism. Yes, this is true, but I feel like the reality is a little bit more complex because even in Massachusetts, most gateway cities, I think 2/3 of the affordable housing comes not as a result of subsidies or incentives, but they are homes that have been built and become affordable by virtue of their age or changing locational attributes, or what academics usually call naturally occurring affordable housing. So I feel like the bigger challenge is, of course, we have to talk about the production of new affordable housing, but we have to also ensure that there are protections in place to preserve affordability over the long term. And the second part of it is because when we talk about homeownership, it's a process, and particularly in a racialized environment, only if there is a supportive ecosystem that enables low income and minority households to access and also sustain homeownership does it really result in wealth building trajectories. So if we look at this from a 30,000 view, I mean, I am training to be an academic, so this is a little bit in abstract. So if we think about it in abstract, even if there wasn't a dire demand supply mismatch as we see in Massachusetts, simply because of the intersectional attributes and structural inequalities in the system, it does lead to systematic extraction and dispossession of racial minorities. And I feel like time and again, we have seen this play out in multiple ways across the country. And I don't have to underscore the mental and physical trauma that results from these daily lived experiences of racism. To move then to pathways of pathways of home ownership and wealth building. and eventually intergenerational economic mobility. Because finally, I've been in multiple locations where people say that, hey, you know what? Homeownership is not for everyone. But the point is that in this country, people get a head start only when there is intergenerational wealth that has been passed on to them. And that's true for everybody. So policy support can be an important disruptor in going from this sort of system of extraction and dispossession to wealth building opportunities. But my work in Chicago shows that when that policy support is mediated through a network of intermediaries that have the potential to engage in daily practices of activism against that systemic racism, and it provides access to a range of support services, then they are able to collectively amplify the disruption of status quo. So I'm going to show you a little bit of what this means in the city of Chicago and in the suburbs of Chicago. What I found is there is a structure of nonprofit intermediary networks that operate at various scales. I'm sure they're here as well. Maybe they look slightly different. What I found is that this sort of structure, it's a spatial structure, operates at different scales, and works really well to combat some of the systemic issues that are there in housing markets. So what I found is that, for example, an organization named Neighborhood Housing Services is one that I worked with. When they have to work in neighborhoods, they usually work with multi-sectoral anchor institutions who work at the neighborhood level. For example, the Southwest Organizing Projects works in predominantly Latino communities in the Chicago Lawn neighborhood, and the Preservation of Affordable Housing works predominantly in the Woodlawn neighborhood. And in turn, Southwest Organizing Project works through a network of faith-based institutions and schools. So what they do is they focus their work on the community in ways that will strengthen and uplift all of these community support networks, the systems of care that they have fostered over a long period of time. So they work on strengthening public schools, they work on strengthening the interfaith movement, they work with immigrant communities. In fact, they organized and helped immigrant communities, undocumented immigrants, get temporary driver's licenses so that they could go to jobs. They organized to make sure that their kids get in-state tuition instead of get charged out-state tuition. So even these small things that matter for urban life and in creating political agency, these networks of organizations are able to hold communities together. And finally, when you have this kind of a network structure, it also allows you to access the larger ecosystem of services, which is legal aid or health services or reintegration or financial literacy services, homelessness prevention services. Somebody can't pay an electricity bill. So where can you access the right kind of help for that? So all of this is possible because there is that integrated network of support that not only provides support for homeownership by providing housing counseling services, but also works on community building, provides support during shock events like the housing crisis of 2008 or the pandemic in 2020. And they kind of have the structure that supports people in their daily lives. So this sort of structure is absolutely crucial in making sure that communities are supported from below. And even if they have to move from owning to renting and back to owning, there are structures that help them navigate that process. There is racism in the mortgage markets, but these support structures help to combat some of that racism by looking through the tactics of the banks and the mortgage industry, right? I also found that there is this system of support that recognizes the vulnerabilities associated with group identity, but at the same time, it celebrates the collective strength in them. So there is this sisterhood or camaraderie, if you will. And that is really essential because I've worked with Latino housing counselors who, will work to make sure they would go to the homes of older adults, sit with them, file tax abatement forms, make sure they're getting the help that they needed, make sure they're able to make their mortgage payments in time so that they don't lose their home. It's this sort of informality in the way the system of support works that is really crucial for how people are supported. And these informal community protections are vital risk mitigation mechanisms. So an important question to ask, even in the Massachusetts context, is which intermediaries work at the grassroots to challenge this sort of racism, negotiate with power structures, and reduce housing precarity and enable access to wealth building pathways? And what kind of systems are there to support them? How can we strengthen these institutions that work at these multi-scalar levels that really do the work of helping lower income communities? I feel like this is something that the institutional capacity development does not get enough attention within policy and in research. I did some updated data analysis of the distribution of intermediary networks in Chicago before and after the pandemic. And unfortunately, what I do see is that if you look at the image on the right, it does show that these networks have dissipated in the 4 years after the pandemic. And unfortunately, it sort of goes against the pattern of location of low income and minority households. If you look at a preliminary analysis, this is my last slide. If you look at a preliminary analysis of what's happening in Massachusetts, kind of unraveling a little bit that issue of really low homeownership rates for Latino households, what you see is that I would be really concerned, not so much with the number of people who've been denied home ownership loans, but the ones that have been denied home improvement and refinance loans, because this is setting them up for dispossession. This is setting them up for having no other option but to go for more predatory kind of loans to upgrade or refinance when they need to leverage the equity in their homes. So this is something we need to think about. Thank you.
Great, thank you very much. Remind you to all the participants that we do have the Q&A for your questions, and you're welcome to put in your questions there. And also, we call this webinar series Voices from the Field because we do want to amplify and celebrate the voices from their community members, those that are directly working on this. And so with that, I would like our guests, Joe, Alex, and Lou, to provide some reflections on some of the data that you just heard about. First, the data, just any comment related to some of the data that was presented. And then secondly, potentially some examples from your communities that directly speak either to the data or its connection to health. And so I welcome any of you to speak. Alex?
I don't mind.
Sure.
Sorry, go ahead.
Okay, thank you. No, I thought the data was extremely informative and very consistent with what I'm seeing in our community here in Worcester in terms of some of the challenges that we're seeing with the Latino population. You know, we have about 70 to 75% of our residents are Latinos that live in public housing. So it's a really high number. And one of the biggest challenges that we see, obviously, is assisting folks to move out of housing, no longer depend on the housing assistance. And home ownership is certainly something that's at our core that we try to really work on with, which is, you know, what was presented. One of the struggles that we saw initially was as we assisted folks obtain, whether it's home ownership or even just go into the private rental market, if that was an option they wanted to seek, was that we had a number of folks returning back to us as residents because of the lack of, for lack of a better word, life skills on maintaining a home, understanding the responsibilities that come with that. Just from budgeting to just understanding the responsibilities of being a homeowner versus being a tenant with a landlord. And so, what's worked for us at the Worcester Housing Authority has been really investing in that. Investing in programs that not only help people reach self-sufficiency, but we call it Thrive Academy, which is looking at the 5 cores, which is financial, education, employment, health, and personal, and really trying to make sure that our residents, when they leave us, they have enough of that knowledge in order to be able to not return back to us. Our wait lists are 20,000 for public housing, 22,000 for Section 8. When someone applies today, and I always say this, people come to apply at a housing authority not because they have time to wait, right? Not because they can, I'll come back in 5 years, just want to get my name on the list. They're applying because they need an apartment today. And it's really disappointing when you tell someone it's a 7-year wait, it's a 10-year wait. You can see the air just come out of a balloon for them. And so I think the one other point that the doctor talked about, which was relative to the nonprofits in Chicago and so many nonprofits working, I see a lot of that in Worcester. We have a lot of fantastic nonprofits that do work. If I had one, if you want to use the word criticism, or one point, is that so many of them, you see duplication of work. And because they're smaller in size, sometimes they may not have the impact they want to have on a larger number. And I'd love to see in Worcester for a way for us to be able to reduce that duplication and be able to then come together and share some of those resources to serve a larger community. So I'll pause there because I know time is limited, but I just thank you again for that. It was very informative.
Joe?
Thanks for sharing, Alex. And Dr. B. I think everything you both shared is extremely profound. I want to add that I think we'd be remiss not to talk about the tie between a health crisis and a financial crisis. The clients that we serve have varying degrees of health insurance, and as you had mentioned before, Alex, using the emergency room as primary care is a marked quality or indicator of high poverty areas. And I think one thing to add is just that, if somebody goes through a health crisis, there is also a financial crisis, and that impacts their housing stability, that impacts their ability to put food on the table, and that impacts their ability to keep the lights on and keep the heat on. And so, while having this conversation, it's just important to recognize the state of healthcare in this country and what that means, not necessarily for the people with healthcare, but for the people without, and how this is almost by design another way to kind of keep impoverished populations exactly where they are. At the Neighborhood Developers, we serve we're Chelsea. Chelsea's a gateway city. We primarily serve immigrant populations, many of whom are from, or most of whom are from, Latin America or the Caribbean. We've seen an influx of people from, for instance, Haiti. We also have a lot of people from, Honduras or Colombia, or, so we serve people who are, this is the first city in the United States that they land in. And a lot of it is not education. And I think obviously home ownership is important, but I think that's not even where our population is. Our population is really kind of what are taxes and how do I complete my taxes? Or my documentation may not be lined up yet. How do I work? Because I still have to pay rent, even though I'm not authorized to work right now. And so home ownership would be a great kind of 10th or 11th step, but there are a lot of like, welcome to the States, and here's what we have to teach you first that really present themselves as more pressing issues. Thinking about not necessarily think, and the other thing I'll add is just, you know, around anti-displacement work, there's a lot of work that goes into anti-displacement and thinking about how to lower the cost of someone's you know, monthly groceries and enrolling them in SNAP, how to get someone enrolled in healthcare, how to get them any affordable housing or subsidies that they may qualify for is all sort of part of that to lower their monthly overhead and expenses. And then as you had mentioned as well is education. You know, how do we get you job skills to stay where you are, and become a higher earner? And then the last thing I'll say is just that being displaced is in and of itself expensive. Having to relocate, having to you know, Chelsea is a gateway city. I think everybody I believe knows this, but we abut the city of Boston, and so yeah, sorry, I forgot where I was going with that. But oh, so being displaced means that when maybe you didn't need a car before because you're in a high transit area, a high touch transit area, you now need a car, which is more expensive. Your childcare might be with a provider who shares a different culture or who has a different culture from yours, and so you may feel a little less comfortable sending your kids to a different care provider. Not to mention the expense of that care provider. Groceries become more expensive because you can't find the ingredients that you're trying to shop for at a nearby grocery when you move farther out away from a city. And so the expenses that are associated with displacement far exceed just the cost of housing. It's the cost of relocation. It's the cost of everything that comes with being farther away from what your support system looks like. And so, you know, that's just a really, in my opinion, a really important topic or point to touch on.
Thank you, Joe. Lou, any thoughts?
Sure. Lou Finfer from Mass Action for Justice. Thanks for inviting me. When I was a tenant organizer in Dorchester in the early 70s, I got to work with Mauricio Gaston, who was a tenant organizer in Jamaica Plain back then. And on January 30th, Lorna Rivera, your director, spoke at a panel on Latinos and school desegregation that our Boston Desegregation Busing Initiative and TAG sponsored. In terms of housing, I also want to lift up, we referred to the impacts on people. I also want to lift up the concept of social emotional learning, which is often talked about in education of children, affecting the children and even the teachers. So those mental health issues are a consequence of income, a consequence of moving, a consequence of stress on parents, which is felt by children. So I just wanted to lift that up as another term on the health connection. In terms of, Professor Sonia mentioned also community organizations' role in changing housing policy. And I wanted to lift up one group, the massive, and it was referred to in the slide earlier, Mass Affordable Homeownership Alliance, MAHA. I was the first director from 1985 to 1991, and we negotiated an affordable mortgage program called the One Mortgage Program that has enabled 26,000 people to buy homes since then. That program continues. The state housing agency, Mass Housing, has an annual group of affordable subsidized mortgages that people can go into a lottery for, and another group called NACA, Neighborhood Corporation of America, has an affordable mortgage program. Those are, there's not enough, but those exist and need to be publicized more so Latinos can apply for those. Some certainly are, but not enough. I also want to lift up the state and local strategies that will affect this. On a statewide level, there are campaigns. Legislation has been filed for what's called for rent control to regulate rent increases of absentee landlords, and legislation for what's called a real estate transfer tax, which would be a tax on real estate, especially high-priced homes and structures, which would go into an affordable housing fund. Those are pending at the state level. And at the local level, there's a number of things that can be done. All the cities have adopted the Community Preservation Act, CPA, and all the cities get a major federal block grant called Community Development Block Grant. But many cities do not. The CPA can also be spent on historic preservation and parks and environmental. And even though housing is the most pressing need, many communities are not making housing the highest percentage of use of the CPA funds. And the community development block grant funds, which can really be spent on almost anything, including housing, very little is spent on housing. So there's a number of things that people can do at the state and local level to increase affordable housing access and maintain affordability. And the last thing I wanted to mention is wages. There were campaigns that Raise Up Mass did to raise the minimum wage twice over the last 10 years. It was raised to 15 in January of 2023, but we've lost ground already with inflation. So we need to increase the minimum wage again. There is legislation pending for that as well.
Thank you.
Thank you.
This is a question to all of our panelists. I'm wondering whether you can think about potential stories from your many decades of work in the community, specific stories of or examples of how the housing crisis has also created an impact on Latinos and their health specifically. Part of our motivation for this full conversation here is how are these social determinants such as housing, affordability of housing, it's impacting the well-being of our communities. And so I'm wondering whether you, any of you might think of an example that you might want to highlight here.
I mean, I can speak to personal experience. A little bit about me. I'm originally from the Bronx in New York, historically impoverished area. I am the product of a Section 8 program in New York, and I can tell you that just my own personal health. I grew up with asthma. It was something that was pretty common when I went to grade school in New York City. After college, I moved out. Pardon, my cat's behind me. After college, I moved out to Georgia and then eventually Michigan, where I had no issues with asthma, and so that was something that I either grew out of in my 20s or really was kind of a result of being in an area with fresher air, and thinking about the communities that we serve. We're adjacent to Logan Airport, and so airport traffic is rampant in the communities that we serve, and so things like lung health and pulmonary disease is pretty common, and it's I think an interesting thing about our community, and that includes our team, is that a lot of the people who work with us are, they're ingrained in our community. They're part of, they live in the neighborhoods that we serve, and so oftentimes, it's not uncommon for someone to need to take a sick day because their child is home, suffering from asthma for the day. And so I think we've all become kind of numb to it and kind of blind to it because it's just part of our lives. But that in and of itself is a real marker of living in an area with low air quality, which is just intimately tied to to wealth. And then thinking about things like utility services. I mean, I live in East Boston, and 100 feet from my house, they're constructing a brand new substation that's in a floodplain right next to a field, right next to a playground. I think there's just a general disparity and a general disregard for communities that are impacted by poverty when it comes to things like respecting land, respecting waterfront areas, public spaces, all of which are directly tied to physical and mental health, which is also tied to financial well-being. So anyway, I digress.
I can talk about one of my interview respondents during my research in Chicago. They were a single mom of 2 kids, and they had a situation where during the lead up to the housing crisis, Wells Fargo fraudulently started foreclosure proceedings. and that person fell really ill, and they didn't know what to do, obviously, and they had some social support networks for sure, but they didn't know what to do. This lady told me that her church pastor visited her in the hospital, and they were also a housing counselor, and they helped them connect to the right lawyers to file for bankruptcy. And it was very difficult for her because she was raising two teenage daughters in that house. And so it's that system that helped her work through the crisis, through a time period of very acute mental trauma and health issues and not knowing whether they were going to be out on the street. But they did file for bankruptcy. The system did help her get back on her feet. She also, when we were talking, she said, sometimes I don't like, she said, this is what I got from the conversation. She said, I'm not sure I believe in God, but my kids used to go to that church for their after school program. And the church has also helped me a couple of times before in accessing money to pay some of my electricity bills. And so that's how I knew that person. And it turned out that that person helped me save my home and build back the wealth. And then now I've paid my home fully, So I thought that really captured well what a community of care can do for households, racial minority households, in navigating the process.
Great, thank you. We have a question from the audience. This is a question Mary Jo is posing to all of the panelists. What are the potential impacts should the federal government roll back housing support and aid? It's the reality of today, right? And so I'm wondering whether anybody would like to provide some.
I do know that the Consumer Finance Protection Bureau is being gutted as we speak. So it all depends on us and what we can do to protect people from predatory products out there. And then this is not just housing, right? Even if somebody needs a car to get to work, car loans can be so different, can look so different, right? So it's all levels of protection are needed.
Congress is
Oh, go ahead, Lou. Sorry.
No, go ahead. That's fine. I'll go after you.
I was just simply going to say from a public housing, subsidy level, it certainly would have a tremendous impact for us. For many, many years, maybe decades, we've rarely ever been funded at the amounts that are required. And so any cuts of that sort will just continue to gut out programs that are critical in helping our residents be able to receive these resources. On the Section 8 side, that impact is not just directly to the resident that we're helping, but you're also talking about landlords. Certainly, if they're not receiving the assistance, that also can have a tremendous impact on having landlords want to participate in a Section 8 program. I'm hopeful, but certainly we're all planning for different plans, right? Plan A, Plan B, Plan C, in terms of the potential level of cuts. But certainly we would see a tremendous impact, I think, throughout the nation, but certainly in Massachusetts for sure. Go ahead, Lou.
Yeah, there's a lot to do. The House Republicans just passed a budget, initiative. It's to move the budget process, which involves over $1 trillion in budget cuts across the federal budget, including housing. And they're trying to advance that together with another major extension of tax cuts for corporations and wealthy individuals. That's a priority of President Trump. And it's not clear how that's going to work out, but that's their top priority. And they're trying to maneuver it through a process called reconciliation, which if they're able to do that, which isn't clear yet, but they have a good chance to do that, you only need 51 votes, or really 50 votes in the Senate to do that. Unlike other bills where it could be blocked if you don't get 60 votes. So there's really tremendous things to do. We have an all Democratic congressional delegation, but certainly there's still roles that Catherine Clark's the #2 Democrat, and Congressman Neal from Springfield is the ranking Democrat on the Ways and Means Committee that has a role in this, and Senator Warren and Markey are very active. But it's going to have a big impact. Massachusetts does have $2 billion in millionaires tax money to expand in this year's budget, and it also has $9 billion in its what's called rainy day fund, which is the second largest rainy day fund of states. That's not enough, but there are some things that may have to be drawn on because of the level of crisis and cuts that we likely are going to face.
Mm-hmm.
One thing. Oh, sorry.
Go ahead, Joe.
I was just going to mention, I know the question was around federal budgeting, but you know, I think one important topic to discuss is the current state budget that's on the table, and changes that are being made to a vital service or a vital resource for that our community taps into. It's called RAFT, which is rental assistance for families in transition. These are emergency funds that are available for, you know, folks who are facing a housing crisis. That could mean things like an eviction notice, or if a landlord decides to, you know, quit the lease and give someone a 30-day notice. As it stands now, RAFT guidelines allow for $7,500 per household per 12 months. And this is a service that we provide via our partners at Metro Housing Boston, where we help our clients submit applications and their landlords complete their portion of things, and they can get a check, you know, to be able to stay in place. The current guidelines or I think what's currently on the table for the Massachusetts budget right now is that it would transition to $7,500 every 24 months per household, which would be a major shift and would be pretty detrimental to the work that we're doing. So I'd just be remiss not to mention that what's going on a Commonwealth level.
Thank you. A quick follow-up to this question. So previously we talked about how some community-based organizations and nonprofits can support those structures that exist. And I'm wondering whether there's some models that you've been exposed to that might be worth of mentioning here, you know, as strategies, knowing that this could potentially come down the line. What are some structures that can be created at the community level with community-based organizations or nonprofits that would help build that support and strengthen that support?
Yeah, I think that's a great question. And I think to answer it, it involves a little bit of context around the neighborhood or the neighborhood developers and what we do as an organization. So we're a community development organization. We have about 700 apartment units under our portfolio that are affordable housing for the community. That's one part of our anti-displacement work. Another is the direct services that we do in Connect. So emergency rental assistance, SNAP and nutrition programs, workforce development. We do free tax preparation under the volunteer income tax assistance program under the IRS. And then there's another part of our organization called community building. What community building does is they really organize the community and empower them to advocate for themselves. We don't consider ourselves advocates directly, you know, in terms of this. We help organize the community and empower them to advocate. And I think that model is really important because it's not driven by a bunch of people who work at a nonprofit advocating for their best interests. It's, you know, people who directly benefit from these services, people who can tell stories about their own experience benefiting from these services and how they elevate them. You know, as housing professionals and as professionals in the fields that we do, we can advocate all day. Having someone really tell their story is a completely different situation and can be way more impactful when speaking with electeds.
Also, other groups like Joe's Neighborhood Developers is generically called a CDC, Community Development Corporation, and there are others like Lawrence Community Works, Coalition for Better Acre in Lowell, Urban Edge in Boston, and EBA in Boston that are focused, you know, on Latino communities. And all of them also have an organizing component as well as developing affordable housing component like Joe's group does. So I wanted to lift up those, and I also want to lift up La Colaborativa in Chelsea. Is a they're doing incredible amounts of work on services and community organizing with adults and youth. So that's another model real organization.
They're a close partner of ours. We love LC.
Yep.
How do you form those connections between these different organizations? How do you facilitate those connections? How do you navigate those services if you're a person that is coming into those communities?
Is that for me? Sorry.
It's a question to end, whether it's in Worcester or in Chelsea or in Chicago. I think.
Yeah, I mean, what I would say is that, I have been with this particular organization for about 7 months now, and what I can say is that that's been a big charge of mine is how do we build systems internally that when someone comes to us for housing assistance, we can follow up with them maybe 2 weeks later and say, hey, do you need help getting some job skills? Can we help you? Can we help empower you to, get some skills training to become a higher earner? And so, our executive director, Rafael Maris, likes to say, do you like fries? Would you like fries with that? When we think about our host of services, a challenge for a call to action for the team that works directly with clients is think about other services that we can get them that really help empower them to, to stay where they are. And so one is just empowering the team to do that, and two is building the systems that support that. So how do we, how do we set a reminder for someone to refer to another service and another program after a crisis has ended, right? Because the other part is just like the human to human piece. If someone comes to you in crisis with an eviction notice in their hand, we're not going to ask them if they need a better job right now. We need to build a system to remind us to ask them later. But I think kind of thinking holistically and not this person has an evictions in front of me, but like this person is directly impacted by poverty and it's presenting itself right now as an eviction notice, but the systemic issue is poverty. And so how do we think about that, in kind of in more of a prescriptive setting where we say, okay, poverty, here are all of the things, and now how do we get you as many services as you'd like to help elevate you?
Yeah,
This
and
is,
I would. Oh,
sorry.
I'm sorry. No, you go. Go ahead.
And this is very similar to what I saw also in Chicago. The Southwest Organizing Project had what was called the system of care. When families come into the neighborhood and they know that their families that they're going to need help, even if they have a touch point for any one of their programs, if nothing else, if they're part of the they had a program to strengthen public schools in the neighborhood with the parent mentors. So even if a family gets in touch with one of the programs, they had the opportunity to access this, what they call system of care, where they could then come and connect with the right kind of services they need. It could be it could be a very wide range. And like Joe pointed out, it could be that, okay, I need my help. So to prevent homelessness, I need help with my next electric bill. To prevent homelessness, I need one rent or help paying the next mortgage. And then the help starts there. And then they get connected to the other kinds of services. It could be legal aid, it could be health, it could be stopping their kid from joining a street organization. It could be reintegration services. It could be a very wide range, and then they know where to plug them in. Another example is this partially answers your previous question. In Joliet Spanish Community Center, when we were talking, I went back to them to talk about the pandemic and how they're going to distribute the CARES Act money for relief during the pandemic, because it was still the Trump administration. She said, we do this creative accounting process because we know who should not be given the CARES money. So we find other pockets of money that are private foundation funding, and where we don't have to, disclose their citizenship information, and then we help them out that way. So these are these small acts of resistances and support that have to be built from the ground up. Organizations like Joe's are like crucial, right in the middle of that system of support. And the way they network with that whole ecosystem is what really matters finally. Because communities' needs will change, family needs will change from time to time.
Is there any time to ask a question, Adán?
Alex wanted to say something real quick.
And I'll be very, very brief, because I'd like to leave the folks that are joining us today with at least a resource that I would love to promote, which is if you know anyone that lives in public housing or receives a Section 8 voucher, please make sure that they go and join the Family Self-Sufficiency Program. They call it FSS. And as we talk about resources, joining that program not only allows you to save money, we have folks that graduate with $20,000 that they can put as a down payment on a house. But also when we talk about how to help folks connect into resources, that's what our staff does. If they have a DCF case, our staff will be an advocate, or at least connect them and help them. It could be with the school. A child could be on an IEP, and the parent doesn't understand that. Again, we help connect the dots and put them with the right resources. You mentioned CLA, even internally. They might have put a request for maintenance and they don't know how to check on that. We serve as an advocate internally. So this program is a great program. I assume everyone knows about it, but so many times I walk by people and they had never heard of it. FSS, tell them to join. It will make a tremendous difference for them. So thank you.
Thank you very much. Well, we're out of time. Thank you, everyone, for joining us today and providing us your insight. Thank you for participants who joined us on the webinar. Yes, Fabián?
I just wanted to announce our next event, which actually connects very much with what Joe was saying about health. So maybe that would be the last slide. So once we say, I would like to say something about that.
Well, I just wanted to thank all of our speakers and our participants. Go ahead and close it out then, Fabián.
First, I want to thank you all participants, and you, our panelists, to be here. I want to invite you to our next event with the Latino Health Collaborative and the Gaston Institute. It's going to happen on May 8th. I'm going to have Professor Tiffany Joseph talking about her book, and especially Joe was talking about all these different kinds of health, right? Where we're thinking about health and connection, what it means, especially for our immigrant community, our mixed status family, that is going to affect in a significant matter. I would send this information to all of you, but again, thank you for being with us, and thank you for all our participants. Have a good day.
Take care, everyone.